Can you guys see it?
Zoom in a little bit bigger and then scroll as you speak. So that's good right there. Thank you.
So, I'll go through with discussion where I'm talking about the pathophysiology and what make this population of patient more susceptible to fungal infections, and some discussion and conclusion where I'll talk about different cases which were found in the world with this population. Very rare in the United States. Some of the other diseases which are found with this population. But basically, blastomycosis, it's a fungal infection which is caused by blastomycosis dermatitis. It's mostly found in eastern and central United States. Uh, other than that, there is the respiratory restrictive lung disease, which I'm talking about, coal worker pneumoconiosis, which is commonly found in coal miners and people who work in construction industry. In this patient, I'm talking about a case which is found in Southwest Virginia, which is a region common with fungal infections. So this patient came in, is a 64-year-old male, came in with a past medical history of cold worker pneumoconiosis, was smoking, had obstructive sleep apnea, and has been retired and was traveling to Florida annually, had a vacation home there. Came in 6 months ago with shortness of breath, progressive cough, and some back and neck pain. Initially, we did some imaging with chest X-ray. Chest X-ray showed some mediastinal and hilar lymphadenopathy. First we thought about maybe it's a granulomatosis disease that's pretty common in the area. So we started treating him with steroids. The patient would get better with steroids, but as soon as he's off the steroids, he would again go back to his baseline. Again, his symptoms would come back. Even tried with antibiotics, maybe some anti-inflammatory effect for COPD, but it didn't help. So eventually we did a CT chest. The images are shown here. Just showed some bronchiectasis and some nodules. But overall, CT was unremarkable as well, with some hilar lymphadenopathy. Still, patient was kept on steroids for some more time, but eventually the symptoms didn't improve at all. So we did a bronchoscopy. Bronchoscopy showed some nodules. If you can see some inflammation and nodules. So a biopsy was taken, and eventually under the GMS stain and H&E stain, there was some fungal infection, which was noted. If you can see the cell wall of the fungus, the dark purple stain is a double contoured cell wall, and that's remarkable for fungal infections. The results came back, and the pathology report suggested that it was blastomycosis. So this is a very rare presentation in colorectal pneumoconiosis because these fungal infections usually have most commonly presented in immunocompromised people, not immunocompetent people, and particularly in these presentations, there have been cases in the world, particularly in China and India, about mycobacterial infections and some fungal infection, but in US there are rarely any cases about that. So what happens is basically what we are suspecting, the pathophysiology and what made this patient more prone is that cold worker pneumoconiosis happens because of the carbon and the silica dust. So that silica dust accumulates in your that silica dust triggers an inflammatory response in your body, in your immune system, in your lung, and that's what causing the lung damage and scarring and destruction of the lung tissue, which makes it more prone to this immunocompromised infections. So that's what we are thinking, that cause of this in this population, what made them more vulnerable to the fungal infection. As I talked about, the coal worker pneumoconiosis continue to be very common in coal miners, particularly in Southwest Virginia, where a lot of people have this occupation and work in coal mines. The studies have shown many mycobacterial infections, such as TB, as particularly in China. There have been studies which have shown tracheal involvement, but for TB, but nothing for fungal infections. So this was a rare presentation of a cold worker pneumoconiosis patient having this endemic fungal infection. And that's the reason we wanted to present this case that the tracheal involvement of the lung in patient with cold worker pneumoconiosis are even prone to have fungal infections. Recently, I think 2 months ago, we started him on antifungals, itraconazole, and he's been following up closely at the clinic. He's improved a lot based on my last conversation with the patient, but his next follow-up appointment is next month. And if he still, continues to improve, that's a good sign. If not, then we were thinking about navigational bronchoscopy. Maybe, there's some other nodules or some other fungal infections which have missed. Uh, but this case underscores the importance of considering the endemic fungal infections consistent particularly in patients with cold worker pneumoconiosis, and that's the reason we wanted to present this case. Any questions?
Awesome job, Jamin. Thank you. I'm glad to hear the patient's improving as well. Our question for you is, if these two diseases kind of have a common geologic overlap, why do you think it's more rare or less commonly reported in the literature?
The mycobacterial infections and fungal infections.
Yes, the pneumoconiosis and
So
the
TB, I think the sole reason TB not being in these patients is because TB in US is eradicated. In other parts of the world, for example, China and India, the cases are more prevalent for TB. The reason it's more because the inflammation this is more makes you more prone to granulomatous diseases like TB. But the sole reason it's not been reported in the US is just because everyone has been more vaccinated, and we are trying to get like almost 0% cases of TB in US. That was the other reason. The fungal infections, that was the rare ones. They were very limited. I think 1 or 2 cases in China, but they had the other kind of a fungal infection, not blastomycosis, but histoplasma was seen. But it's a rare, but the only reason not TB being in this population is just because it's US and it's been TB has been 90% eradicated from US. Very rare cases I've seen.
All right. Thank you so much. Great job. So I think we'll take a few minute